Hey, another little video for you just to give you a little bit more information about health. Hopefully that this is something that you're thinking about each and every day as you go out into your life. And hopefully this is something that will help you have a better, less painful life and more productive life. So we're glad that you're watching our video today. You know, research estimates that about 80% of the population will experience back pain at some point in their lives. Now, it's very interesting that back pain is one of the most common reasons that someone sees a doctor in the United States. Actually, it's up around number one or number two, at least in the top five all time of why someone might go see any type of doctor. Most of the time, people try over-the-counter pain drugs, and they usually serve as that first resort to get some relief. But disappointment in the results from those types of over-the-counter type drugs leads to obviously doctor visits and obviously at sometimes powerful prescription drugs like opioids, which is the big buzzword at least in the United States right now. And whenever opioids are, whenever they're prescribed, at least in the state of Florida, I know that medical doctors, whoever you're seeing for that, if they're going to give you, or if their plan is to give you opioids, they have to hand you a brochure that talks about the alternatives to those opioids. And chiropractic is one of the top things that you can do for back pain. In fact, in some research back in 2015 compared the outcomes for patients with lower back pain. And I believe they used massage therapy, physical therapy, drug therapy. I think those were the ones that they used. But it was found, and then chiropractic care, and it was found that chiropractic care, the patients who started with chiropractic care spent almost 70% less for pain relief when you compared it to the other treatments. So not only does this study show that chiropractic is effective for lower back pain, but it's also cost effective for lower back pain. It's less expensive, more economical, if you will. I hate to say things are cheaper, but it's more economical, it's less expensive, and it really is, you get more bang for your buck, if you will. So when you're dealing with lower back pain, chiropractic should be your first choice, not your last choice. Sure, over-the-counter medications and that type of thing may help, and if it does at first, good for you, and that's great, but your next stop should be to a chiropractic doctor because they're trained to find out what may be wrong, what may be the underlying cause of that lower back pain. Now, there's a lot of things that cause lower back pain. It can be muscular. It can have to do with the discs in the lower back. It can have to do with the joints called the facet joints in the lower parts of the back. Frankly, you can have a problem with cancer. You can have a lot of problems. And the great first line of defense when you go to a chiropractic doctor, if it's something that they can handle, they'll handle it for you. If it's something that they can't handle or something that they expect or might think that this might be a worse problem than we originally thought, they can get you to the professional that can help you, whether that's a medical doctor or a neurosurgeon or an oncologist or whatever it is, or they can refer you for the tests that you need to find out what exactly is causing that lower back pain. So just a little bit of information about lower back pain. Realize that it's the most, just some bullet points, it is one of the most common things that people seek out care from a doctor of any kind. We know that chiropractic care is the treatment of choice for lower back pain. And thirdly, finally, the last resort here, if the chiropractor doesn't think that they can help you, or they think that you need to be referred out to another type of professional, they will do that. That's something that we're very well trained in. So hopefully that helped you a little bit, and hopefully you know a little bit more about lower back pain now than you did about 5 minutes ago. So I hope you have a great day, and we'll see you soon.